Welcome to Roxy Surgery Day at Clarksburg Animal Hospital. I'm Dr. Greta, and this is Roxy. Roxy has a growth on her neck that needs to be removed and biopsied. She's a little worried while we examine her to be sure she's still doing well enough for surgery today. Then we give her some pain medication. In a few minutes, she'll be ready for us to put in an IV catheter. The catheter goes into her vein so we can give fluids and medication. Roxy says ouch a little. Now I give an anesthetic in the vein to make her sleepy and begin anesthesia. We give just as much as they need rather than a specific dose. So once she has enough, we'll stop giving it. Next, we place a tube in her trachea to protect her airways and give her gas anesthetic to keep her asleep for the entire surgery. We tie that tube in so that it stays secure and doesn't slide out. Now connected to the anesthesia machine, we gently inflate a cuff to seal her airway. That's Roxy's IV fluid bag. We'll keep her connected to the fluids to maintain her hydration during her surgery. She gets connected to the EKG and pulse oximetry so we can monitor her vitals. Her hair is shaved from around the growth past where the incision is planned so we can be sure to properly clean it for surgery. She'll get multiple scrubs with antiseptic and alcohol before we start her surgery. Dr. Greta has to scrub and get clean too, even though she'll be wearing sterile gloves. Here comes the surgery part in case you're a little squeamish about those sorts of things. I make the initial incision through the skin. It's wiggly, so I have to hold it tight to make the incision properly. Then I work to separate the tissues while watching out for larger blood vessels. We do this gently a little bit at a time. Finally, we get through the last bit of attachment and the growth is completely removed. I'll come back and sew her back up shortly. First, we have to put the growth in a jar of formalin to preserve it for the pathologist. I suture the skin in 2 to 3 layers. This is the last layer we're putting in. I avoid skin sutures because they can be irritating. We use a small amount of tissue glue right at the end just to hold the little edges of the skin together to make it look nice. Now Roxy gets more pain relief. Before she wakes up, we place lidocaine around the incision. It'll numb it and she won't notice any soreness for a couple of hours. Roxy is awake enough to breathe normally without her tracheal tube, but she's still drowsy and resting comfortably. Roxy is more awake but still a little woozy. She did a great job and had a great crew take care of her. If you don't already know us, we welcome you to come see how gently and thoughtfully we care for your pets and you.